Hey there, I'm Lisa Carter, the host of The Source, a web series by Arcadia where we use data and technology to drive healthcare innovation. Here are some highlights from our latest episode. And to watch the full episode, be sure to visit arcadia.io/the source. You can also register there for other sessions or request a personalized demo of our platform. Many care management teams are overburdened with manual processes to get an all-encompassing view of patient data. How can healthcare companies streamline their workflows to reduce this burden?
One of the biggest problems that care managers encounter is finding all that data among different systems. And so it's really important, and one thing that we do it really well at Arcadia is aggregate data from different sources into one place so that care managers don't have to go searching for the information they're looking for to give the best care that they can to their patients. You might have a patient that is working with a provider in one health system and one medical record system, and you might go to a hospital somewhere else, and the provider doesn't see that distinct information from different systems unless you bring that all together into one location. And so that's what's really valuable about the Arcadia patient chart and care management application, where we bring all that data into one single location where we can see the history of visits, of emergency visits, of admits to the hospital. We can see all of the medications that that patient is on, whether or not they've filled those medications, whether they've been prescribed, because we bring together that different claims and clinical data that allows for that full view of the patient across the spectrum of care where they're receiving care.
We have many care management programs struggle to identify patients and enroll them in cohorts. Is there technology available for patient cohort creation, manual, automated? Connor, can you go ahead and kick us off for this one?
Arcadia's care management tool is great for this and allows our clients to be able to create different sets of criteria for identifying patients that require care management services. So our automation engine can use claims data, clinical data, ADT data. We've talked about transitions of care a lot already today, but using that data to drive that automated identification side of Arcadia's tool is really key. And while we know that resourcing is never what we want it to be, and we always wish that we had an army of resources in any specific role, be able to have that automated identification is going to make sure that any limited resources we have are working as efficiently as possible, with the main goal of driving positive outcomes and having a return on investment for the resources that we're providing to our patient population.
Healthcare enterprises rely on trustworthy data to facilitate efficient caseload management, improve care collaboration, and minimize risk. What tools are available to track that progress?
At Arcadia, we are all about data. And so we can take the data that you're bringing in from your other healthcare sources, along with your data that you're generating in Arcadia, like your care management data, and have really enhanced reporting suites to understand how you're actually affecting those patients that you're working with and how performant your programs are at working with patients and achieving outcomes. And lastly, one thing that we think about in reporting as well is how do we benchmark performance of our care management programs among other programs that with Arcadia's really broad data set, we can generate these benchmarks to compare length of stay, readmission rates, ED events, or post-discharge spend, to give you a better idea of how your programs are actually performing compared to others who might be running those same programs, so that you can work towards improving your performance and increasing ROI on those programs to best serve your patients and your care teams.
Arcadia has a handful of reports out there that help demonstrate this efficacy and also show how are the care managers performing operationally. And specifically, one of the reports we have is talking about that impact of the care management programs and what's the impact they're having on cost, utilization, and overall outcomes of the patient population. Because the day-to-day execution of care management is important, but we don't take a step back and review these different reports to figure out how do we make the right tweaks in the right places to ensure our program is running as efficiently as possible so we get the highest ROI possible.
So as you all can see through the great examples provided by our speakers, it is very evident that better care management is possible. To see more of what Arcadia can do, you can schedule a demo. For details on our next episode, data management, keep an eye out on your email for how to register. Thanks again, and we'll see you at the next episode of The Source, where data drives healthcare innovation.